So we know that women are dying in childbirth in the United States more than any industrialized nation, and that it's been going up for a while now. We recognize that Black women are at 3 to 4 times the risk of death of childbirth than white women in this country. And it's an alarming statistic. Most things are 2 times, or 2 times as likely to be obese, or 2 times as likely to have hypertension. But when we saw this larger gap, we really had to get a grasp on what was happening. And so despite income or despite education, we know that we have higher rates of death in childbirth.
So I think that Black women are impacted substantially more than others because of a history of institutional racism that's embedded in every system in our country, including the healthcare system. And so the other protective factors like education or income or other things don't even protect Black women at all in terms of having better outcomes. And so it's a systemic problem of hundreds of years of policies that now we see the results of in where even Black women who have formal power still can't have full power and autonomy in their pregnancy and childbirth. I think that if we really look at the disparities both in access to care, quality of care, and outcomes of care, all of those is where we see where Latina women and other communities of color are also impacted.
Black race is having a problem specifically as far as maternal morbidity and mortality, but that we've also seen that the numbers are rising overall for women dying in the United States, but disproportionately 3 to 4 times as many Black women as white are being lost. So you could be in the midst of the highest level perinatal health unit being attended to by high-level, high-risk OB physicians and still be in a maternotoxic environment because perhaps implicit bias or institutionalized bias or racism, classism, the fact that you may be other and your very presence evokes this response around you. That is, in and of itself, that's toxic. All of these things create toxicity around this mother-baby unit. We know that the opposite works. We know that when women are respected, when women are listened to, when women are trusted, when women are supported, that they don't experience that same toxicity, that same danger.
We need to invest in women of color because women of color are the ones most at risk for experiencing adverse outcomes such as maternal mortality, maternal morbidity, lack of access to care. And I believe in the saying, nothing about us without us is for us. And so if we really want to improve healthcare and public health for women of color, we need to not only engage them, but really give them resources to lead in the work.